Hi, I'm Bob Johnson from MedFaxx. One of the things I wanted to talk to you today about was osteoarthritis pain. And we certainly understand, having been in the chronic pain business for over 30 years, that many times patients that are suffering from osteoarthritis simply because it is a chronic pain. But what we're trying to do with those types of patients is you're trying to reduce the level of pain to where they become more functional and they can do things without having to take drugs and or other types of procedures that may not help them in the long run. That's one of the reasons we use electrotherapy or interferential and TENS for those types of applications. Now, one of the problems with osteoarthritis pain is over time people lose their range of motion. And one of the reasons you can't actively move like you used to was simply because it hurts to move. So what we try to do when you're using, example here, the Infrex Plus unit, we actually put electrodes on and we can do a treatment that will last basically only 30 to 45 minutes if you're using interferential. And during that time period, that pain that say it's coming out of your joint, your knee or whatever, we should be able to basically minimize it or eliminate it during the treatment. So it's only like a 45-minute treatment to see, did it work? That's one of the nice things. Now, once we have gotten rid of the pain, then you can start your movements again without having pain inhibit your range of motion. It's very important in any type of chronic pain cycle that you maintain range of motion as long as you can. You do not want to start limiting motion. There's plenty of physiological reasons, and talking to you about osteoarthritis, I know I'm not as qualified. You live it. I only talk about it. Fortunately, I'm not suffering from osteoarthritis yet. But if you can keep the range of motion, if you can stay active, you've already heard you keep the blood flowing, you maintain elasticity of your muscles. These are things that are important when you've actually worked and you've actually stayed active, and at night you get ready to go to bed. One of the things we recommend people do is use the interferential. Put it back on the interferential side of the Infrex Plus and take a treatment before you go to bed, because that may help you sleep through the night. And it's very important with chronic pain to try to maintain a decent sleep cycle. Now, during the day when you wake up, take your treatment on interferential. You should have what's called carryover relief. You can check our videos. We've got, you just write carryover on our website, and that'll explain that more to you. But when you're out and moving around, you take the unit with you. You can also flip it back over to the TENS side. TENS is nothing but a way that you can use the Infrex Plus and you can wear it 24/7. If your pain is hurting you, if a joint's hurting you, what you do is you put your electrodes on, you just wear your TENS unit, you keep it on. If you start doing something that becomes more painful, you increase the power of the Infrex Plus. That will help you overcome that pain, and you can keep doing the things you want to do. Now, the nice thing about this is whatever I'm telling you, I don't expect you to believe me, and I don't blame you, because that's the way you should be. You should be very cautious of modern-day snake oil salesmen. This is not snake oil. The reason I say this is we offer a free trial. It's free. What we want you to do is we will work with you to help you with your osteoarthritis pain. We will do what we can, but we believe enough that we can help you. We'll offer you a free trial. See if it helps you. If it doesn't, there's no cost. We know, based upon 30-some years of experience, working only with patients with chronic pain, such as osteoarthritis, that we can help make your life better.
Go to painreliefmachine.com/free to get started on your free trial with the Infrex Plus.